So today we will discuss congenital infections. ঠিক আছে? So have you heard of the term called TORCH infection? TORCH. 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 TORCH শোনোনি কেউ কখনো? Nobody has heard TORCH? Yes. Please, what is TORCH? Okay, so you are close. Have you heard of the term SCORCH? SCORCH শুনেছো? TORCH তো সবাই শুনেছে। SCORCH শোনোনি? But that is a new terminology. Okay. TORCH is there in your book. You will find TORCH in your book. But SCORCH is not in your book. ঠিক আছে? So we will see. কয়েকটা জিনিস যেটাতে আদার্সে ছিল সেটাকে বার করে একটা সেপারেট ক্যাটাগরি করে দিয়েছে SCORCH। ঠিক আছে? So it's nothing fancy. So we will start off with the things you have already, I think you know what is horizontal transmission and what is vertical transmission. Bosho. Horizontal transmission মানে কি? The thing which spreads from a person to person horizontally. For example, tuberculosis, horizontal transmission through airborne route. ঠিক আছে? Hepatitis B, it can be transmitted horizontally through needle stick injury. ঠিক আছে? Malaria, horizontal transmission through mosquitoes. But whenever you say that a infection has occurred to the fetus from the mother, then it is called vertical transmission. ঠিক আছে? Vertical transmissionটা কিন্তু অনেক রকম ভাবে হয়। ফার্স্ট ইনফেকশনটা ইন ইউটেরো হতে পারে, সেটাকে আমরা বলবো congenital infection. মানে কি? Fetus is in utero, the birth has not yet occurred, but the infection has spread through placenta. ঠিক আছে? এটা একটা ভার্টিক্যাল ট্রান্সমিশন। আরেকটা ভার্টিক্যাল ট্রান্সমিশন হচ্ছে ডিউরিং দ্য ডেলিভারি অর আফটার দ্য ডেলিভারি থ্রু দ্য ডেলিভারি কানাল। সো there are infections which spreads to the infant during the normal delivery. ঠিক আছে? So those are also included in the vertical transmission. TORCH is this: Toxoplasmosis, T, O for others. Others এর মধ্যে অনেক কিছু আছে। You have Parvovirus, you have Syphilis, you have Malaria, you have Zika Virus, and many more. Then you have R. R stands for Rubella, C stands for Cytomegalovirus, and H stands for Herpes Simplex. Okay? So, এটা হচ্ছে TORCH. So, remember, whenever you are reading congenital infection, the first thing that should come into your mind is TORCH. ঠিক আছে? In fact, some of the laboratories, they will have these tests as a panel. ঠিক আছে? টর্চ প্যানেল। টর্চ প্যানেল বলতে এই যতগুলো ইনফেকশন রয়েছে প্রত্যেকটা ইনফেকশনের একটা করে আইদার অ্যান্টিবডি নয়তো অ্যান্টিজেন সামথিং দে উইল হ্যাভ ইন দ্য প্যানেল। ইট ইজ সো ভেরি ফেমাস। ওকে, আচ্ছা, আদার্সের মধ্যে কি কি বললাম? সিফিলিস বলেছি, ভ্যারিসেলা জস্টার বলেছি, পার্ভোভাইরাস বলেছি। পার্ভোভাইরাস ইন দ্য ইনফ্যান্টস দে ডোন্ট কজ আ ভেরি fulminant disease, but if you see parvovirus as a congenital infection, it is very life threatening. Okay, then you have Zika virus, congenital trypanosomiasis, and malaria. Acha, next is perinatal infections, means during the delivery. ঠিক আছে? During the delivery মানে যে কটা ব্যাকটেরিয়া and virus which causes sexually transmitted infections, all the bacteria and virus can cause a perinatal infection to the infant. ঠিক আছে? কি কি হচ্ছে তার মধ্যে? গ্রুপ বি স্ট্রেপ্টোকক্কাস আছে, ইকোলাই আছে মোস্টলি, দেন ইউ হ্যাভ দ্য আদার ব্যাকটেরিয়াস লাইক নিজেরিয়া, ক্ল্যামাইডিয়া অ্যান্ড এভরিথিং। ঠিক আছে? ইন কেস অফ পোস্টন্যাটাল ডেলিভারি, দ্যাট মিনস ডেলিভারি হয়ে গেছে বাট স্টিল দেয়ার ইজ আ ইনফেকশন হুইচ ইজ স্প্রেডিং ফ্রম দ্য মাদার টু দ্য ইনফ্যান্ট, সেগুলো হচ্ছে মোস্টলি দ্য আদার পেরিন্যাটাল অর্গানিজম অ্যান্ড multi-drug resistance gram-negative bacilli. Now I was talking about something called SCORCH. Okay, it's a very new terminology. ঠিক আছে? It may not come in the exam, but I think you should know because many of the places this TORCH is being highlighted or is being replaced or is being overemphasized by a new term called SCORCH. SCORCH is nothing but they have split syphilis and varicella into a separate group. Okay, others এর মধ্যে syphilis and varicella was there torch ঠিক আছে scorch এর মধ্যে S for syphilis, C for chickenpox or varicella, then you have other infections, then rubella, then toxoplasmosis, cytomegalo and herpes. বাকিগুলো সেম আছে, শুধু syphilis and chickenpox is in a separate group. ঠিক আছে, so that is what you call scorch. আচ্ছা, now coming to the first disease, which is toxoplasmosis. Okay, toxoplasmosis is a disease that you already know. Toxoplasmosis হয়ে গেছে তো class? Toxoplasmosis, you see the incidence rate is not very rare. It is 1 per 1000 live birth. So we cannot call it a rare disease anymore. Okay, so you have 1 per 1000 live births. কিন্তু এর একটা মজা আছে. See, if the mother is infected very early in the pregnancy, that is in the first trimester, এ যদি 0 to 13 weeks এর মধ্যে ইনফেকশনটা হয়, then the incidence of the infection is the lowest. Okay, the incidence of infection is the lowest. কত percent? Around 10 to 15%. But যদি infection হয়, then it is the most severe form of the infection. So the earlier the disease in the pregnancy, the incidence will be low, but if the disease occurs, the severity will be high. ঠিক আছে, similarly, if the disease is in the third trimester, that is after 28 weeks, the incidence will be high, but the severity of the disease will be low. Okay, so late infection means higher transmission and lower severity. So this you will have to remember in the congenital toxoplasmosis. কি করে হচ্ছে? What are the roots? The roots is the same that you have read. By eating uncooked raw vegetables, by eating uncooked or undercooked meat which is contaminated. Okay, so all these things, and also with the contact with the cat, because cat feces, they harbor this organism. So from these two roots you can have infected. কি কি হতে পারে? You have a triad of chorioretinitis, then you have hydrocephalus, and you have intracranial calcification. Okay, so these three things you will find in the congenital toxoplasmosis affected infant or affected, but mostly it is initially asymptomatic, কিন্তু যখন ডেভেলপ হবে তখন এই তিনটের মধ্যেই ঘোরাফেরা করবে। এছাড়াও you will have IUGR, intrauterine growth retardation. You will be seeing some psychomotor disturbances, or the baby will be stillborn. Okay, stillborn. আচ্ছা, lab diagnosis কি করে হবে? না, intrauterine anything you have to diagnose, the first thing that comes into your mind will be a ultrasound, a fetal ultrasound, USG of fetoplacental profile, FPP. Okay, that will be the first investigation of choice. এছাড়াও what you can do is you can do a amniotic fluid PCR, amniocentesis বলে জিনিসটাকে. You go into the and take out the fluid, and then you can do a toxoplasma PCR. Although it is an invasive procedure, it has its own risk of many complications in the pregnancy, but that is a method where you can do a amniotic fluid PCR, or you can also do a amniotic fluid culture, live tissue culture করতে পারো মাউস কিংবা টিস্যুতে। আচ্ছা, এছাড়াও after the baby is born, you can do the diagnosis by newborn and maternal sera, যেখানে we will see the IgM and the IgG. So this is basically a postnatal diagnosis. Postnatal diagnosis এ কি হবে দেখো, the IgG titer of the neonate should be greater than 1000. So that is a indicator that the neonate is suffering from the congenital toxoplasmosis. কিংবা যদি আমি IgM করি then that should be a quantitative IgM যেখানে কিনা 1:4 এর বেশি হতে হবে after 2 weeks of age. Okay, after 2 weeks of age the titer of the neonate, the IgM titer should be greater than 1:4. আরেকটা উপায় করা যায় যে IgA, you know IgA is the secretory antibody that is present in the mucosal surface, তাই তো? So IgA, if you see after 10 days of birth, that IgA does not belong to the mother. So whenever you are finding Toxoplasma specific IgA in the neonate after 10 days of birth, that means it is the IgA of the neonate itself. It is not the IgA of the mother. So that is again a diagnostic criteria for toxoplasmosis. ঠিক আছে? So if the congenital or neonate is being diagnosed, then we have drugs, oral pyrimethamine and sulfadiazine, that can be given for 1 year. Okay. Next you have ফন্ট গুলো এরকম আসছে কেন পিপিটি তে? ফন্ট গুলো এরকম ছিল না, ফন্ট গুলো কিরকম একটা আসছে। আচ্ছা, next you have congenital rubella syndrome. Okay, everybody is interested in the picture. হ্যাঁ, ভয় লাগছে নাকি দেখে তোমাদের? Congenital rubella syndrome. So it's a RNA virus, rubella. Okay, and it has a high risk of transmission. কি করে হবে? The classical triad will be the neonate will be having a sensory neural deafness. Okay, a sensory neural deafness. কিছু cardiac problem থাকবে. For example, the neonate may have a ventricular septal defect. The neonate may have pulmonary artery stenosis. The neonate may have patent ductus arteriosus, PDA. Okay, so cardiological defects are these. Sensory neural deafness বললাম, আরেকটা হয় salt and pepper retinopathy. Okay, so these are the three things, or these are the three systems, ear, eye and heart, that is involved in the congenital rubella syndrome. Okay, remember that. আরো কিছু কিছু থাকে যেমন hepatosplenomegaly, bone changes এবং IUGR. IUGR is common to all of these things. Intrauterine growth retardation কিন্তু common. And one more interesting thing is called blueberry muffin syndrome, because of the compensated or the compromised, heart or the compromised arterial venous system, the baby will be having a blueberry muffin syndrome. See, alternate white or alternate red and bluish kind of patches or discoloration of the skin. ঠিক আছে? We call it blueberry muffin syndrome. Okay, lab diagnosis is again by detection of antibodies, IgM and IgG. If the IgG antibody is persisting beyond 9 months of age, beyond 9 months of age যদি IgG persist করে, then that is a diagnostic, because maternal IgG গুলো সাধারণত 9 months আগেই শেষ হয়ে যায়. So if it is specific IgG of the rubella which is persisting beyond 9 months, we can call it a IgG of the neonate itself, and the neonate is affected. এছাড়া we can do a RT-PCR for the RNA virus. Next you have a vaccine, rubella vaccine. More or less everybody is vaccinated of rubella. So it is a live attenuated strain rubella vaccine that can be given to all the women of the reproductive age group and the children of 1 to 14 years of age. ঠিক আছে? Nowadays it is combined with MMR. Okay, mumps, measles and rubella. Now you have the next thing, cytomegalovirus. Cytomegalovirus আমি আগেও বলেছি ক্লাসে. So what it does, it has a very high affinity to two kind of cell. One is a salivary gland, one is a kidney. Okay, দুটো সিস্টেমের প্রতি it is a specificity and affinity, and it causes a massive enlargement in the cell. তাই জন্য ওর নাম হয়েছে cytomegalo. মেগালো মানে বড় হয়ে যাওয়া। ওকে, সো সাইটোমেগালিক ইনক্লুশন ডিজিজ হতে পারে, আর কিছু কিছু ক্ষেত্রে অ্যাসিম্পটোম্যাটিক থাকতে পারে। তো সাইটোমেগালিক ইনক্লুশন ডিজিজ যদি হয়, অর কনজেনাইটাল সাইটোমেগালোভাইরাস যদি হয়, then the patient or then the neonate will be having these triad. ট্রায়াডটা কি হবে? জন্ডিস থাকবে, হেপাটোস্প্লিনোমেগালি থাকবে এবং পেটি কি হবে? on the skin. So you will have petechiae on the skin, you will have hepatosplenomegaly, and you will have jaundice. Okay, so that is the triad. Microcephaly, IUGR, stillbirth, sensory neural, hearing loss, এগুলো associated থাকতে পারে. Okay, perinatal CMV infection, that is during delivery, and postnatal CMV infection can be occurring when the baby is fed breast milk. Okay, so that is a postnatal transmission route. Now we will go to lab diagnosis. This you have already been taught in class. The cytomegalo inclusion body will be owl's eye appearance. Okay, so you will have owl's eye appearance. The virus can be cultured into certain cell lines. Okay, and then you have antigen and antibody detection, also a specific PCR for these regions of the virus. এইটা এত ডিটেলসে মনে রাখার দরকার নেই. You can only tell that we can do a PCR for targeted regions of the virus. Now antibodies, the CMV IgM antibodies, they appear around 1 week after the infection. So see, IgM detection in pregnancy, it will automatically tell you whether it's a congenital infection or not. CMV IgG is non-specific because it will indicate either past infection or present infection. এটা determine করতে পারে না, but if you do a avidity test, then you can determine. Treatment এর মধ্যে the drug of choice is ganciclovir. Okay, if the patient is resistant or if the isolate is resistant to the ganciclovir, then we can do foscarnet. ঠিক আছে, ganciclovir কিংবা foscarnet is the ideal therapy. আর prophylaxis দেওয়া হয় কাদের ক্ষেত্রে দেওয়া হয়? To the transplant recipients. ঠিক আছে, transplant recipients they we give a ganciclovir and valganciclovir prophylaxis. Prophylaxis means the disease is not yet present, but we will give the drug so that the disease probability is eliminated. Okay, so that the disease doesn't occur. Okay, now come to herpes. It is very rare because see 10 out of 100,000 births, that is how it is, neonatal herpes. But neonatal herpes jodi bolo, we have HSV1 and HSV2 as we all know. But in this case, in congenital or neonatal herpes, HSV2 is more common. Okay, HSV2 is more common. Okay, so neonatal herpes you see the local lesions will be involving 3 parts. একটা হচ্ছে skin, একটা হচ্ছে eye, একটা হচ্ছে mouth. Okay, skin, eyes and mouths will be affected of the neonate. In case you have disseminated disease, then the patient might appear very septic. The patient might go into a rapid deterioration of the multi-organ disease. এবং যদি CNS infection হয়ে থাকে, যদি further the patient is not treated, then the patient may land up into encephalitis. Encephalitis বলেছিলাম মনে আছে, herpes encephalitis. So that is what happens if the patient is left untreated. But if you see congenital herpes, I'm not talking about neonatal herpes, I'm talking about congenital herpes, when the herpes is being transmitted to the fetus in utero. Okay, so that is what happens is the skin of the neonate become scarred. ঠিক আছে, scarred হয়ে যায় because granulation tissue they come up. The mortality is very high. If you see 65% of the neonate will be dead. Okay, so the mortality is very high. PCR kore from the vesicles you can detect the virus HSV2. You have to treat the patient for acyclovir for 6 to 12 months. But on the note, if you have to see that the mortality of congenital herpes is very high. So we have to prevent or we have to treat the genital herpes of a pregnant mother before she goes to the delivery period or before she progresses with the pregnancy. So it is need to be treated. Now coming to the varicella zoster or chickenpox. Okay, chickenpox is one disease that will affect both the parties, that will both the mother also, the child also, or the neonate also. Okay, acha, fetal or congenital varicella syndrome jodi hoy, tar mane ki the infection has occurred to the mother very early in the pregnancy. Tai jodi hoy, then it will be transmitted in utero and the neonate will be having fetal or congenital varicella syndrome. Okay. The most important thing that you have to remember is there will be cicatricial skin lesion and limb hypoplasia. This is an example of limb hypoplasia. So, there is a not underdevelopment of the limb. It can be superior extremity, it can be inferior extremity. Okay, but mostly we see superior extremity hypoplasia. এছাড়াও আর কি হবে, you have microcephaly, you have mental retardation, you have seizures. So all these things will be coming in as a complication of the disease. And you have low birth weight. But when the patient or when the mother is affected by the varicella zoster near its delivery period, that is in the 3rd trimester. So what will happen is, if the mother is affected with chickenpox more than 5 days before delivery, remember the timeline, delivery 5 দিনের আগে যদি হয় তাহলে mostly the child is protected because the mother will be passing on the antibodies to the child. But if the infection is occurring within 5 days of the delivery to 2 days of the delivery, post delivery 2 days or before delivery 5 days, এই timeline টাতে যদি হয়, then the chickenpox is will be transmitted to the neonate. We will be calling it neonatal varicella. A neonatal varicella তে কিন্তু mortality rate খুব high because it is a very severe form of the disease that will occur in the neonate. As you can see, the whole body is affected with the crops or with the vesicles of the chickenpox. Next you have parvovirus. As I told, parvovirus in the children, it will cause slapstick syndrome or 5th disease, but age 8 in the children it is very not so very dangerous form of the disease. But if it is developing inside by a transplacental transmission, that is in utero transmission or congenital parvovirus, then you have a probability that it will cause a Hydrops fetalis, Hydrops fetalis, and this will be a non-immune Hydrops fetalis. Okay, so there will be a Hydrops fetalis and which will result into anemia and fetal death. So that is very important of the parvovirus. Jodi in children hoy tale to bollam it causes 5th disease or slapstick syndrome. This you have already read before. Next you have Zika virus. The last day I was talking about Zika virus. Remember, what is the transmission route? Zika transmission route ki mone nei? খুব সুন্দর। Zika transmission route তো লেখা আছে এখানে, Aedes aegypti. You read Aedes aegypti it can transmit Zika virus in adults, but in case of mother to child transmission, it is again possible, vertical transmission of the Zika virus. Monkeys are the reservoirs, and it was concerned with Zika forest in Uganda, but now it has come to our region. Outbreaks have been recorded in Africa and Asia Pacific. Rajasthan outbreak chilo, Madhya Pradesh outbreak chilo. I think I have shown you in the slide in the last classes. Clinical manifestation Zika virus e ki hobe? Rash and conjunctivitis and congenital Zika syndrome or CZS. CZS e একটাই মাত্র feature you have to remember, it is microcephaly. Okay, microcephaly means underdevelopment of the skull and it will be very small size of the skull. Microcephaly, automatically microcephaly hole neurological manifestations like Guillain-Barré syndrome and everything will come. So this is how a Zika affected neonate will look. You can see that the child's head is underdeveloped, it's very small. You will have microcephaly, এর সাথে সাথে you will have neurological syndromes. Lab diagnosis, Zika virus PCR we have, and RT-PCR is the investigation of choice because it is a RNA virus. So, reverse transcript is PCR. এছাড়াও you can do enzyme immunoassay detecting antibodies IgM, or you can do a plaque reduction neutralization testing. Coming to syphilis, syphilis is not very rare, it can occur. But you see, antenatal screening is very important. Whenever a woman is going in for a pregnancy or is pregnant, then we generally screen these pregnancies with many of the markers. So one of the markers is syphilis. Okay, syphilis e ki hobe na 4th month of gestation er pore, okay, 4th month of gestation er pore the fetal damage starts to occur. ঠিক আছে, untreated case maternal syphilis they have a high chance. আচ্ছা, late congenital syphilis এ একরকম হবে, early congenital syphilis এ একরকম হবে। যদি early congenital syphilis হয়, that means within 2 years, then কি হবে, there will be certain mucocutaneous changes. You see, mucocutaneous changes, and there will be rhinitis. Okay, rhinitis and mucocutaneous changes hobe, eta hocche early syphilis, that means before 2 years. After 2 years jodi thake, we will call it late congenital syphilis. Sei symptoms gulo kintu arekটু alada. You have deafness, 8th nerve deafness, and you have interstitial keratitis and bilateral knee effusions, joint effusion. So these are the presenting symptoms if the neonate or if the child is affected with the syphilis. This is called the late congenital syphilis, which will be manifested after 2 years. Okay, before 2 years mucocutaneous, after 2 years it will be mostly the joints and the deafness. Diagnosis is definitely by demonstration of the Treponema pallidum. It remains same with the dark ground microscopy. Congenital trypanosomiasis, it is rare. Okay, it is rare because trypanosomiasis emni ekটু rare আর congenital trypanosomiasis aro rare. So trypanosoma cruzi, it can be transmitted transplacentally. Detection will be by IgA, again IgA and IgM. Our features a low birth weight, stillbirth, neurological alterations, myocarditis, এই সবগুলো থাকবে। One thing that is very important to remember in this part is, in the pregnant woman, the cord blood and the placental impression smear is very important. Cord blood and placental impression smear থেকে you have to make slide, thick and thin slide. সেখান থেকে you can detect this organism. Okay, so এই জিনিসটা remember, কি cord blood and placental impression smear থেকে you can make thick and thin smear, from where you can detect this trypanosoma. Next you have malaria. Malaria can be transmitted. Malaria transmission route kintu onek. It can be transmitted by blood transfusion also. So whenever you see a whole blood or a packed cell, you read on the label. Label er moddhe thakbe, it is screened for syphilis, it is screened for malaria, it is screened for hepatitis B, C and HIV. Okay, so all these things can be transmitted by blood. Okay, so malaria can be also transmitted by pregnancy, where you can see that বিশেষ কিছু চেঞ্জেস ফিটাসে হয় না। সো কনজেনাইটাল ম্যালফরমেশনস যেগুলো এতক্ষণ ধরে দেখলাম সেগুলো থাকে না, বাট ইয়েস there will be some changes in terms of growth and development, where you will be seeing some premature labor, some low birth weight, some growth retardation occurring if the mother is suffering from malaria late in the pregnancy. So what more can occur is anemia, hypoglycemia and pulmonary edema. Okay, এই তিনটে হয়, but that can be countered, that can be treated. Okay, so mostly these are the things. Okay, so remember TORCH এবং যে মেইন ডিজিজ গুলো Toxoplasma, okay, and Rubella, so all these things you have to read. পরীক্ষায় কিন্তু TORCH can come as a question. It is a very important question. Whenever there is a congenital infection, the TORCH should be in your mind, and it can come as a question. টর্চ ইনফেকশন বলি একটা কোয়েশ্চেন আসতে পারে, ঠিক আছে। বি প্রিপেয়ার্ড ফর ইট,